welcome to Medical Dialogues. I am Dr. Nandita Mohan, and every year today, that is the 12th of October, we celebrate the World Sight Day. Now, World Sight Day is an important occasion to actually raise awareness about visual impairment and also to promote eye health. Now, to talk to us on this aspect, we have with us today Dr. Sandeep Buttan, who is the Global Technical Lead at Eye Health Asia at Sightsavers. He did his MSc in Community Eye Health from London School of Hygiene and Tropical Medicine, University of London. Dr. Sandeep currently leads the development of national strategic priorities and action plans for Sightsavers eye health portfolio in India. He also leads strategic advocacy for integration of eye health into broader health context of the National Urban Health Mission in India. Prior to this, he worked as a community ophthalmologist at Dr Shroff's Charity Eye Hospital from September 2010 to April 2013. Welcome to Medical Dialogue, sir. We are really happy to have you on board here with us today.
Thank you, Nandita. Thank you. Thanks for having us here.
So, today as we celebrate the World Sight Day, what according to you is the significance of this day and why is it actually celebrated?
So, as we are kind of aware most of the times that our eyes probably are the most precious gift that nature has given us, but oftentimes we see that that's forgotten. Both at individual level and at a societal level, we forget the importance of good eye health. And this is a day that kind of is used to emphasize the need for prioritizing eye health both at an individual level and at a societal level. And that's the reason why we've decided to celebrate World Sight Day as a remembrance for making sure that everyone, everywhere, is thinking about their eyesight, both for themselves and for the society. And that's kind of the core of why this event is celebrated. We try to interact at all levels of the society, from common people to working class to children to policymakers, and emphasize the need for good eye health practices.
Very nice indeed, sir. So if we talk about this, if we talk about a little bit of detail, what according to you, or what rather measures can individuals take on a daily basis to actually protect their eye health?
That's an excellent question. And coincidentally, the theme of World Sight Day is Love Your Eyes, which again goes to say that we are not taking care of our eyes enough. We get kind of, whether we are working or we're kind of entertaining ourselves on a screen or just routinely, we're not taking enough care of our eyes, and that sometimes leads to certain difficulties and visual problems. And at least on this day, we try to emphasize that whenever we are doing something visually, we have to think about whether it is having a damaging effect on the eyes. Some common things that we can definitely talk about is excessive use of digital screens. How do we protect ourselves when we are working or just entertaining ourselves on video screens? Do we take enough breaks in between? Is the lighting proper? Are we eating good nutritious food which is helpful for our eyes, like fresh fruits and green vegetables? Are we hydrating ourselves well? We shouldn't be using any eye drops or medicines without proper medical advice so that we don't damage our eyes. Again, limiting exposure to things like dryness or dust or direct sunlight are some things that can be done at a very individual level. And of course, a recommendation that at least on an annual basis, getting our eyes tested at a formal facility so that comprehensive examination can be done is another advice that we would want to promote to people to keep their eyes healthy.
Well quoted, sir. So I think you've concised the basic measures that an individual actually has to take on a daily basis. So what are the leading causes of visual impairment and even blindness globally, and how can it be prevented, or even if it is diagnosed at an early stage, how can it be treated?
Great, Nita. So, despite of it being an ignored kind of disease, blindness is again one of the most kind of diseases which affects all ages of population. Globally, close to 2 billion people are blind because of blind and visually impaired because of various causes, and more than half of them are because of causes which can easily be treated, prevented, or even dealt with just a simple pair of glasses. So the most common causes for blindness, particularly in India, are largely things like cataract, which essentially is a blurring of the lens inside the eye, which causes the vision to drop. Refractive error again is a very common cause of visual impairment where the vision drops because of not having a pair of glasses. Certain emerging diseases like diabetic retinopathy, glaucoma, and various disorders of the front of the eye, which is the cornea, are also things that are leading to visual impairment and blindness. Fortunately, a large majority of these can be either treated, for example, the refractive errors with just a pair of glasses, or if the person requires contact lenses, they can be easily treated. Cataract now has become one of the most successfully treated disease with a cataract surgery, which can be done and the person can be restored of vision. Things like diabetic retinopathy and glaucoma, although the vision loss because of them cannot be treated fully, but they can definitely be prevented by early identification and following the clinical advice of the doctor that whoever sees you. So as you can see, that a lot of these can be kind of managed with initial treatment, or they can be treated or fully reversed. And that's something that we would like to convey through this message, that a large majority of things can be easily prevented or treated if we approach them early enough.
That is a good takeaway message, sir. The early prevention is definitely better. So, are there any new advancements or technologies in the field of ophthalmology that are actually helping people with vision problems?
Yes, so ophthalmology actually has been at the forefront of technology, both for diagnostic and for treatments as such. Nowadays, a lot of low cost, high quality devices are available, which can let people be screened for various disorders almost at the doorstep or at clinics which are very close to them. In community-based projects also, we used portable devices like fundus, the retinal imaging devices or other things which can look at the back of the eye and identify diseases which otherwise would have been missed completely. Also, when it comes to self-checking, there are some apps available that people can actually self-check their eyes to kind of see if their vision is normal or not. That also is there. There have been recent advances in improving the adoption of things like eyeglasses and all. So various levels of technologies are available which can both be useful in screening or diagnosing diseases, as well as identifying which cases are likely to need more treatment. And all of them are now being researched and being used quite a lot, and they're helping us reach out and identify cases which otherwise would have been missed.
That is a good shift in the technological aspect if we discuss it. So now coming to the next part, what are some of the common misconceptions or myths about eye health that actually need to be addressed?
Yeah, so I think the most common one that is prevailing is that we don't need to go to an eye doctor if we don't have a problem. I mean, we are able to see properly, it should be fine. And if there is a problem, it will show up. And that's, I think, one of the most dangerous ones, because a lot of eye diseases that we are seeing now and are emerging in the initial phase have actually no symptoms. Whether it is diabetic retinopathy or glaucoma or some other disease also, in the initial phases, they usually do not have any symptoms, and which is why a lot of people do not kind of visit their doctors. And sometimes even in children, we have seen the child may have a blurred vision and he or she is not able to see clearly in the school also, but the parents may not realize because the child is able to manage. So one of the things that we want to break the myth is that irrespective of whether you're having a problem or not, an annual eye checkup is very important, because when you reach an ophthalmologist or a trained facility, they are able to find out kind of if there is anything going wrong at the back also, and some of these diseases which later on can become a big problem can be highlighted, can be kind of found out, and the treatment can be started. So that's kind of the biggest myth that we would want to break, that even if you don't have a problem, please visit an ophthalmologist at the earliest on a regular basis, and they would then be able to find out if you have a problem or not. So that's kind of a key message that we would want to give out: a regular eye checkup, and that's kind of a commitment that we can give.
Great. So now that we're talking about regular eye checkups, how can schools and workplaces, apart from the regular eye checkup aspect, how can these two organizations, they actually can promote eye health and also provide resources for their students or employees?
Absolutely. A good eyesight is a strong contributor to productivity, both in workplaces as well as to improve quality of education in schools. So I think that's an excellent place to start. And also, since it's a relatively captive environment, a lot of environmental changes can be done and promotions can be done for that, so that people are aware. The first of the intervention that we would expect in both these locations is awareness, both in terms of management and school teachers and others, to be aware what can be done, so that they are able to kind of tell to the students as well as employees that how can you improve your eye health. Some environmental changes like better lighting is definitely possible. In schools also, we recommend that adequate lighting should be there. Annual screenings can definitely be done and are being done through various organizations, where both for workplace screenings as well as for school screenings we're able to do and identify people who have refractive errors or other diseases can be done. Also, certain adjustments in workplaces, particularly when people are using computers and others, we can kind of stress on the 20-20-20 rule, which means that every 20 minutes you need to look away from the screen and look away at a thing that is 20 feet away and blink your eyes 20 times, because then you're kind of breaking the constant amount of stress that is happening. And this is again something that at workplaces can be done, so that they know that they need to take frequent breaks. And similarly, at schools, the teachers can talk about the harmfulness of regular kind of use of devices like mobile phones and tablets, because when it comes from teachers, it's better accepted than parents. So both these environments can do both preventive screening as well as kind of give them awareness about what can be done to improve their eye health.
Great. So, sir, the 20-20-20 rule that you laid out, that's actually a doable aspect, and it can be done both at the schools as well as even at the workplaces. So that is something that everyone can follow on a daily basis. So what, according to you, will be the lifestyle changes or habits that can actually help in reducing the risk of developing eye conditions as we age?
Sure. Lifestyle has been evolving because of the changing environment, urbanization, more dependence on technology. So some of those have improved the quality of life, but they've had a toll on health, particularly on eye health also. But fortunately, with proper kind of management, this can be done. Regarding screens, we've already talked about that limiting time on visual devices, taking frequent breaks, and using the right kind of settings on the screens, so that the brightness and the contrast are at an optimal level, so it doesn't hurt kind of the person's eye. Of course, wearing the right kind of glasses as advised by your ophthalmologist or the optometrist again is something that can help improve your health during when you're doing stuff. When you're outside, either driving or going out, protecting your eyes from dust, smoke, pollution, and also direct sunlight is something that can be done. So using a good quality sunglass for protecting your eyes from the harmful effects of sunlight is another recommendation. In terms of diet, a good quality of nutrition as well as hydration is something that helps the eyes quite a lot. Fresh fruits, seasonal fruits, green vegetables, we anyway recommend these for all age groups, particularly children, but in all age groups, these are helpful for the general health of the eye. Maintaining a good level of hydration again is something that gets ignored. It's very good for the skin as well as for the eyes. So not only the dryness on the eyes, but it prevents on the skin also. So maintaining good quality hydration. If you're particularly inside and we're using a lot of artificial heating or cooling, maintaining good quality of hydration. So humidifiers are there that can be done. Also, preventing the use of any over-the-counter medication is something that we would recommend. That if you have a problem, whether it is redness or itching or something, don't try to self-medicate, because they can be harmful also. Try to get a consult with a good ophthalmologist and use the medication only as prescribed. That can also be done. So these are some of the lifestyle alterations that can improve the health of an individual.
Wonderful, sir. So we've had a concise version of a lot of key takeaway messages from today's session. So thank you so much for joining us today at Medical Dialogues. It was lovely to have all your valuable insights that you could provide us on World Sight Day.
Our pleasure. Thank you.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.